Dr. Ali Hassoun, infectious disease specialist with Huntsville Hospital, joins us now to talk more about the coronavirus and its local impact. Thank you so much for being with us tonight.
Thank you for having me.
Dr. Hassoun, what's the very latest in terms of our coronavirus numbers and the direction they're headed?
Unfortunately, we've seen significant increase in the number of hospitalization over the last week. Definitely has escalated, where there's significant pressure on the hospital bed, the ICU as well. It's really pushing it to where probably this is going to end up affect non-COVID patient with time and their admission and management as well. It is very concerning.
In terms of projected cases, are we worse off than what we anticipated at this point?
I think today we've reached the number of hospitalization more than what we have ever during the pandemic, even in compared to July. So it's definitely much worse that we're seeing it in compared to the last 7-8 months.
Thanksgiving is just a few days away. What's your message about family and group gatherings during the holidays?
Yeah, I don't think it's a good idea to have Thanksgiving gathering, unfortunately. If you want to do any Thanksgiving dinner, it's gonna need to be just the household. Family member within the same household only. It cannot be any added family because there is widespread infection everywhere.
We've been dealing with the coronavirus for more than 9 months now, and we've talked a lot about COVID fatigue. People are just burnt out on dealing with this. What advice might you offer to someone experiencing COVID fatigue?
I mean, I can tell you the main thing with this is definitely everybody's tired and feel it's been too long. There's a lot of effect on everyone, but at the same time, people have heard about there's hope with the vaccine, possible other treatment options. There's a lot of other things that's coming up. And if the community help us for the next several months till the vaccine come, till we be able to cut down on some of the cases, I know it's not going to end in a month or 2 or 3 months. It will be longer, but with the vaccine, we might be able to cut down on infections. We might be able to help reduce transmission.
Dr. Hassoun, this week, Governor Kay Ivey said that she doesn't anticipate another shutdown. What are your thoughts on that if coronavirus numbers continue to go in the wrong direction?
I think probably we're going to end up need to do at least 2 to 4 weeks shutdown to get to a level of transmission lower where we can control it with masking and physical distancing. I really don't see how we're going to continue doing the same because it doesn't seem working at the moment.
Dr. Hassoun, any final thoughts that you can share with us this evening?
We need, as a community, all together, united to be against this virus and help each other by the masking and physical distancing, avoiding close contact, avoiding crowding, avoid close spaces. These are really simple, but we need the help of all the community because it's getting to a dangerous level. And that shouldn't be acceptable to anybody in the community.
Dr. Ali Hassoun, infectious disease specialist with Huntsville Hospital. As always, thank you so much for your time, insight, and all that you do for our community.
Thank you so much.